Mr. Shah, how are you doing today? I'm going to be doing your head to toe, starting with your health assessment. I'm going to start with your head. Just going to check your head, make sure there's no lesions or open wounds or lacerations, which that looks good. And then I'm going to look at your face as well, make sure there's no cuts, lacerations, or anything that will worry us, which it doesn't. Yep. And now I'm going to palpate your temporal muscle or temporal pulse. Good. I'm going to have you do some cranial nerve facial movements. So can you raise your eyebrows? Can you close your eyes hard? Can you puff your nose, smile with your teeth? Can you puff your cheeks? And then can you frown? Good. And now I'm going to palpate your masseter muscle, okay? So I'm going to have you clench your jaw, open and close. Good. And I'm basically looking for a pop or a crackle here, which I did not feel one. Now I'm going to look at your eyes. Oh, I'm going to do, actually, can you close your eyes for me? And when you feel it, this cotton ball, can you say now?
No, no, no.
Basically, I'm just checking for sensation there. And now what I'm going to do is I'm going to look at your eyes. So I'm just going to look at your eyes, your eyebrows, your eyelids, make sure there's no cuts or anything. And I'm going to also look at your conjunctiva as well, okay? So can you look up for me? Down, right, left, good. Now I'm going to do some accommodation and convergence. So just follow my finger here, okay? And what's going to happen is, without moving your head, your eyes are going to follow my fingers. And I'm just checking for nystagmus or presbyopia, and making sure your eyes are symmetrical. And same thing here with the convergence. Keep your eyes in the finger. Good. That's very good. Now what I'm going to do is I'm going to do the ophthalmoscope, okay? I'm going to dim the lights while having you maintain your sight on the curtain. I'm first going to check your reflex, your cornea reflex, okay, while you look straight. And the first time I'm just going to look at your eye, and then I'm going to look at your other eye, making sure they are reactive and the reflex is working both times. Good. Now what I'm going to do is, while you're looking straight, I'm going to look at your anatomical features, such as your fovea, your macula, your blood vessels, and everything, okay? So continue looking straight. I'm going to start about 12 inches, and I'm going to look and get closer. Same thing with this side. You're doing great. Good. Now I'm going to move on to the ears. So first I'm just going to look at your ears. I'm going to palpate your ears, make sure there's no bumps, bruises, or cuts. Good. And now I'm going to do an auditory test. So you're going to say these 3 words with me, okay? You're going to repeat the same 3 words while I whisper in your ear.
Garbage, can, eat.
And while I'm doing that, one more. Garbage.
Garbage, can, eat.
And then
Sandals, shirt, pants.
good. That's just testing your auditory acuity. Now I'm going to use my otoscope here, and what I'm going to do is I'm going to check your external canal, and I'm going to take your pinna. You're going to feel me taking your pinna, pulling out, back, and up. And at the same time, I'm going to be looking at your temporal membrane here, making sure there's no, or tympanic membrane, making sure there's no cerumen impaction or anything like that. Making sure I see that pearly white, pearly gray tympanic membrane. Now I'm going to go on to the nose and make sure that nose is symmetrical, there's no septal deviation. I'm going to just look at it, Now I'm going to assess for pain and see, can you sniff with one nose and sniff with the other nose? Good. And I'm going to take my otoscope one more time, and I'm just going to look inside your nose, your mucosa, make sure there's no cuts or anything like that. Good. 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 Now that we're done with the mucosa and the nose, we're gonna go to the mouth. So now we're going to go to the mouth, and I'm gonna look at your outside, first your lips. Yep. And now I'm gonna look at your teeth. Can you smile with your teeth, please? And I'm gonna look at your gums, your teeth, your submucosa, your inside. Good. And now I'm gonna have you open your mouth. I'm gonna look under your tongue first. Under your tongue, good. I'm gonna look on the sides and everything like that. Can I look at your tongue? Good. And I'm gonna look at your soft and hard palate back there. And then can you stick your tongue out? Say ah. And I'm gonna go for your gag reflex while assessing your pharynx and your uvula and your back structure. So that's it for the mouth. We're gonna do your shoulder. We're gonna check your accessory muscles as well, okay? So while checking your accessory muscles, I want you to shrug your shoulders and give resistance against mine. Good. Now I'm going to do your neck, assess your neck. With your neck, I'm just gonna make sure it is even, okay, that there's no deviation. I'm gonna check for tracheal deviation as well while I'm here. Good. And now I'm going to also, now that your neck, from palpating it looks okay, I'm gonna check your lymph nodes, okay? Starting with your preauricle, postauricle, posterior occipital, posterior anterior, your supraclavicular, and I'm also gonna check for Virchow's here, submandibular, submental, and anterior cervical. Good, that's mostly it for your throat or your neck. Now I'm gonna check your thyroid. So I'm gonna start off by inspecting the thyroid, seeing if there's any goiter from the anterior approach here, which there isn't. Then I'll go from the posterior approach and I'll hand you a cup of water, just a small sip of water. And what we're gonna do is we're gonna,
I don't know if that's a cup, though.
well, you're gonna have to deal with it. So then I'm gonna find your isthmus, which is your Adam's apple, and I'm gonna go to the side of the Adam's apple, and then I'm gonna put my hands there. And what I'm gonna do, I'm feeling around, but I found the thyroid here, so I'm gonna have you take a sip of water, and while I'm gonna use my left hand to push towards my right hand, just so I can feel that thyroid. I'm gonna have you tilt to the right, and then take a swallow. Good, and I can feel his swallowing down there. And then I'm going on the left side here, same thing. Find the isthmus, go a little adjacent to it, and then use the other hand to kind of guide it. And then he's gonna take a sip, tilt his hand, and then swallow. Good, and I can feel all of that. Thank you very much.